What's up, and welcome to another edition of 40-Minute Debates, where two parties will argue the most triggering social and political issues in 40 minutes or less. My name is Tyler, and I will be your host today. Now, today's topic: has Trump handled COVID-19 well? Let's introduce our contenders. Advocating for Trump is Aadi, also known as PoliticalBhanti on Instagram. What's up, Aadi?
What's up?
What's up, man? I'm just ready to get started here. And
Me
Dominic is going to be your contender today. He is against Trump. So Dominic, say hello. What's up, brother?
What's up, everyone? How's it going?
All good, all good. So viewers watching will be able to vote on who won this debate by visiting our Instagram page at 40-Minute Debates. Now remember, the person that wins the debate isn't necessarily the person who you agree with the most, but the person who made you think the most. The poll will only be available for 24 hours after this video airs, so vote quickly. Now, let me tell you how this is going to break down. Each of you will get 3 minutes to present your opening statements. After this, we will have 6 rounds of rebuttals, 5 minutes each. During each rebuttal, one person will lead the conversation as they see fit. When it's your time, you can ask your opponent questions, address their stance, or forfeit any remaining time that you may not wish to use. The debate will then conclude with a 2-minute closing statement from each of you. Do either of you have any questions before we get started?
Nope.
All right. Do either of you care who goes first?
No, I don't care. I can go first. Can
All
you
right,
guys
Aadi.
still hear me? It
Yep.
says my mic switched. Okay.
Yep, you are good.
Um,
So, Aadi, go ahead with your 3 minutes. As soon as you... Wait, hold on. Let me make sure I got my timer. Bam, got it. So as soon as you're ready, go ahead and get started, and I'll start the time.
Okay. So I think that Trump responded in adequate time and in a measured manner. While the Democrats were focusing on other things, until mid-March, Democrats were encouraging people to go outside and do these parades. And I know that's not the focus of this argument, but it's really showing where the priorities are and why so many people think he didn't respond early enough. Because there's so much polarization coming from the media on the left about the issue. But if you actually look at what they were doing at the time, it was very different. Our numbers are this high because our testing pace is 3 to 4 times higher than literally almost everywhere else. And we both know this, that the COVID deaths are actually inflated. 6 out of 125 deaths in San Diego County were truly COVID deaths. So what they're doing, they're saying, if you test positive for COVID, but you die of something else while you're still have COVID, they're going to count it as a COVID death. CDC gives you more funding. The CDC gives them hospitals in the states more funding. And to be honest, travel bans, research money, vaccine action, and more were put in place very early on. And I think the human cost of the economic tragedy that is going to be far worse than the actual COVID crisis and deaths. That's all I have. So I don't know if I have to use the 3 minutes or not. But
No, man, you're good. You're good. All right. Let me go ahead and restart that. All right, Dom, you have 3 minutes. Get started when you're ready, and then I'll start the time.
Yeah, so for today, I want to address 3 things, right? So we all have to be critical of our leaders, whether it was Obama, Bush, whoever it is, and I hope I do that with any Democratic president as well. So there's 3 things I want to address today. So there's the administrative reaction, right? The timeline on how they reacted, the public reaction in terms of how the president reacted to everything on the timeline, and then the failure, right? So when someone fails, which if any president or any person says they've never failed in anything on anything, then there's a problem, right? So he's failed on some things. And, even under Obama, they addressed it by saying, okay, we need to be prepared. We need to actually make a pandemic response team. We need to do this, this, and this. And so I want to see and analyze exactly what Trump did and said to say, what, this is where we messed up and here's how we're going to fix it. The other thing is their administrative reaction. Obviously, it's the timeline. The public one is really important because I want to see how truthful he was to the public, right? How much was he using science when he was talking to the public and how that was affecting the public too. Overall, what I'm going to show today is that Trump lied to the public. He spread information about cures. He created more work for the CDC and public health officials who, obviously sometimes they've messed up too with timelines. And then he reacted slower than a lot of other countries and a lot of other presidents in an effort to avoid any economic slowdown because he knew that he was obviously going up for re-election. And we know that, a bad economy does not fare well with the voters. To my last point, during H1N1 virus, it took about a few cases and 2 weeks for President Obama to declare a national emergency and actually start using funds. And it took Trump 2 months after the first cases appeared. And while we know that the H1N1 was nowhere near the virality in terms of spreading, as this virus is. So I'm going to be comparing those and most likely just going over all the information that Trump has presented. And my source is actually donaldjtrump.com.
All right. Awesome. Okay, Aadi, you have 5 minutes on the clock. It is your time. Use it as you see fit.
All right. So basically, to address one of the points you made, you said the timeline, acted 2 months too late. But the national health emergency, so there's two different types of national emergency. There's the full-on national emergency, which opens up a different type, a different amount of funding. And then there's the national health emergency, which opens up more and more resources for like CDC and Department of Public Health and all that stuff. So that was actually declared in a timely manner. So to say that the national emergency was held off by 2 months, that's a correct statement, but it's a little disingenuous because there was a national public health emergency declared way before that. Also, one of your other points that you made, he was lying to the public about different types of cures. Well, I don't think he specifically said that anything was necessarily a cure, but he was saying that the hydroxychloroquine drug touted some benefits, and in studies, whether it be in Italy, France, or parts of the U.S., the hydroxychloroquine drug did have a decent enough reaction in response to the coronavirus, and that's why he was promoting it. So I don't know whether it was his place to promote it or not. I'm not going to say that. But I'm going to say that, he wasn't really promoting a cure. He was just saying that, there's good results. And by the way, just for a date on that public health emergency, that was January 31st. Also on that day, the Chinese travel restrictions happened, and we also suspended entry into the U.S. for foreign nationals who posed a risk of transmitting the virus. So I have a question for you. Would you say that the response itself at this point in time, is your argument that it was late, or is your argument that it was bad?
Both. I wouldn't say that any president would have done better in timeline, right? That's not my place to say because I'm not a clairvoyant or, predicting the future or past. I'm saying that it was late because the WHO organization registered it as a level 1, which already should have been a time where he should have started looking. At that point, later on, he's been claiming that our shelves are empty and this and that, yet they declared it a public health emergency back in early January. So when Trump did stuff, you're talking about months, right? So lockdowns, everything, this started spreading back in November. I had friends that were infected in December. They were infected really sick. I bought my masks in December.
But at that time, those weren't really considered COVID cases because people didn't really know what was going on at the time here. I believe our first case was in January.
Yeah, the first
official case. And I think that's what we should be basing this on, because that's when they actually had the facts and whatever else about the coronavirus that they needed in order to confirm it as a case. And so you said that WHO declared it a public health emergency in early January. Well, in January, the WHO was also spreading the lie from the CCP that coronavirus is not transmissible by humans. They were still doing that stuff. They were still promoting CCP lies. So I think it's completely warranted to not trust everything that they're saying. They tweeted out and they put out, you can't transmit coronavirus from human to human. And so who would actually 100% put faith in the organization that put out stuff like that? And they knew very well exactly what was going on here. So that's my question to you. Would you have trusted them to the T? And it's not like we didn't take any action based off of that public health emergency by the WHO, right? January 3rd, CDC director emailed the Chinese CDC offering to send U.S. experts. On January 6th, there was a level 1 travel notice for Wuhan, which is a region, a city in China. So there really is a lot here that just doesn't necessarily add up. And no president. And back to the early, he didn't act early enough. Our first death was on February 29th. Yeah. No president or world leader is going to shut down a country with literally one death. And I know that might make me like a bad person, like I don't care about people's lives, but that's really not the case here. Especially when you're the world's largest economy. And I know that the economy isn't everything. There's human costs.
30 seconds.
There's risk to being a human inherently, right? But no president's going to shut down the world's largest economy based off of one death or even 2 deaths or 100 deaths. I mean, and at this point, they were actively investigating the situation, placing travel restrictions and adding and putting out the social distancing guidelines, which I believe played a very big part in flattening the curve. So I believe I'm about out of time, but I just want to know a bit more about your stance on those few things that I brought up.
Time. All right. Ended it right at the right time. So, okay. All right, 5 minutes. Dominic, I've reset the clock. Go ahead and get started. This is your 5-minute rebuttal. Use it as you see fit.
Yeah, perfect. Okay, so first question for you, and then I'll go into my stuff. Do you think Trump did anything wrong at all during this time?
Yes. So one thing you're going to learn about me, I'm not like Trump kiss ass. I disagree with him.
What do you think? So what do you think? What were the one or two, if you can name, that you're like, he messed up? It was clear as day he should have done this.
A few things that he could have seriously done better on is the way he carried himself in the public eye. I will agree with you there. There's, actions and words are two different things. And, usually actions with Trump specifically, actions are very different a lot of the times.
Than his actions. Okay.
Right.
Yeah.
So I think in the public.
Okay. So let me address that. Right. So you agree that, like, hey, the way he was talking, the way he was kind of explaining it to the public was not in a good way.
To a point.
To a point. From my perspective, do you eat fast food?
Trying to control it,
but you eat fast food.
I have to. Yeah.
So clearly marketing works because their food's not really that good or healthy for you, but marketing works. So when you're talking about the president who speaks to the entire nation and tells them things like, don't worry, tells them things like let me have it up right here. On March 1st, right after the first death, said, this is a hoax, right? The Democrats are pushing this and politicizing this. It's a hoax, which is word for word what he said. He said, the Democrats are politicizing this. The word for word, I'm reading the transcript. The Democrats are politicizing this. This is their new hoax. Okay, word for word. January 31st, Dr. Fauci said there is no doubt that asymptomatic transmission is occurring. Basically saying it is transmitting from people to people. So whatever the WHO says, your doctor in charge of your country is telling you.
This is 2 months after that.
Yeah, that's fine. This is January 31st, not 2 months after that. January 31st, he said that.
I thought you were saying first. I thought.
No. I'm jumping back and forth. Sorry. So that's when he said the hoax, but January 31st, they said it is spreading his doctor, right?
That's the day they declared the public health emergency, on January 31st.
Yes, January 30th. Yes. And Trump said, word for word, at his rally, this will have a very good ending. I will assure you that, right? So he's telling the public, don't worry. And this is why I guarantee you there's no debate that he messed up. Because yes, we can argue about the timeline. And yes, hindsight's 2020. And I'm never going to say, why didn't he act sooner? But even so, he didn't actually lock down anything. He keeps pushing the idea that maybe, I think, maybe some areas, some not, right? He tried to then kind of politicize it and be like, oh, look at New York, they're not really handling it well. He pushed off testing to the states. He then said, oh, Obama had something, and that affected their testing. Do you know anything about that? And what is your perspective on Obama's testing and why it affected him?
Yeah, so let me explain what that Obama comment was.
Yeah,
because I kind of almost that's like a very common argument that people bring up.
Yeah.
So here's the thing. When Obama took office in early 2009, January 2009,
2 minutes.
He was given the worst economy possible. He was given a horrible economy, right? And so they had to find a way to cut costs and save money and whatever else.
So then what happened with the testing?
Let me finish.
We'll make it fast because it's going my time. That's fine.
True. So basically, depleted the national stockpile, which had a lot of the things that you would need to develop a brand new virus test from scratch. Which is why the CDC had a late start. Which is why we had to get really, really ineffective.
But why did he say Obama had certain laws in place that affected the ability for us to have private companies to testing?
Oh, yeah. No problem. I can answer that. So. Under Obama, public-private partnerships weren't really a thing you saw that much, especially in the public health sector.
Was it from Obama?
Those laws were created, I believe, under Obama. But
no, they were created in 2004 under the BioShield Protection Act of 2004. In fact, Obama was going to change it, but because they had resource issues and because that they were getting sidetracked by other issues, they didn't end up changing it. So this is the problem that I have: is he spent his time blaming Obama when he could say, oh, you know what? Like it was depleted from he uses politics instead of using facts and actually just saying, look, and the last thing, this is what happened. He tries to push blame onto someone else, right? So this is my biggest issue, is that he lied about that because he keeps saying Obama. nothing to do with Obama. In fact, Obama was actually going to change it in favor of what Trump is claiming to want to do.
But
secondly, if it was depleted, why didn't he notice it back in January where Wuhan was locked down? Why didn't they say, should we check the national stockpile? In fact, Bush actually asked Congress for $7.6 billion before they had a pandemic and said, I want to be prepared. And that's what happened, and that's what helped Obama. And then when Trump came about, for 3 years did nothing, even though it was so-called depleted, but he didn't care about it until it happened, and then goes, what the heck, man? Why is it depleted? Bro, you knew from January to at least look. Maybe you didn't know the seriousness of what was going to happen. But you knew from January.
So here's the thing.
All right.
You're gonna
hold on. That was time. We're gonna restart it. And it's gonna be all you. So hold on 1 second. All right.
My bad.
No worries, man. I know you get into it, so it's all good, man. I've been there. All right. So 5 minutes. Adi, you are good. Start whenever you're ready.
Okay. So you're making the argument that Trump didn't check the stockpiles. He didn't whatever, right? But in cases like this, it really, wait, I have a question for you. So, that all 50 states are required to have their own stockpile, especially for things like this, right?
Yeah.
Okay. So I assume, and this is most likely the case, and he said this publicly as well, the states were expected to have their stockpiles of ventilators and whatever. If you look, Cuomo actually declined 1,700 ventilators coming to New York for a very low price a few years ago. So, the states were also expected to have some sort of stockpile to combat this based on the projections at the time. And by the way, none of those projections 2.5 months later have even come close to being true.
Thanks to lockdown, yeah.
Thanks to lockdown, yeah. But I mean, look at Florida. But I'm going to get into that in a little bit. Also, now you're making the argument, he didn't activate the CDC and have them do stuff early on. But January 3rd, they started working. They attempted to work with the Chinese. January 6th, CDC issued a travel notice. And I know I've said this, but I'm going to keep going. January 7th, the CDC established a coronavirus incident management system. And what this did is basically have a database of where exactly this is happening. And this had two purposes. One, to identify hotspots, and two, to make sure that, the hospitals don't necessarily get overflowed, because we can manage in the region where you can move around patients, right? And then January 17th, health entry screening. So this is still mid-January, right? Before the first death and a few cases in the country. And then January 20th, they announced that they're working on a vaccine at the NIH. That's what Fauci announced that, not Trump. And now I'm going to go back to the beginning of what you were saying, about Obama. I wouldn't say he might have, that was a little bit of a misconstrued point that he made about Obama. I will agree with you there. But what real effect, and I wouldn't even call it politicizing the issue. I really wouldn't. And here's why. Obama had the opportunity to change it and he didn't. And I agree that we shouldn't be blaming the entire problem on Obama in that circumstance, no matter what. But my question to you is, what actual effect did on the country, on the cases, on the deaths, what actual effect did saying that have?
The problem is that when he spends his time politicizing things and
saying the word Obama takes 2 seconds. I mean, it's not like he was spending an hour talking about how Obama did everything.
But that's like saying I could just in the middle of my thing say fuck this and fuck that, and because it didn't take up too much time, it's not a big deal. It's the fact that he's pointing and trying to cover up. It's an obvious show of him trying to cover up. Because you even said Obama had the chance to fix it and he didn't, right? Mm-hmm. Did Trump have 3 years and not also fix it?
Well, here's the thing. For this COVID crisis specifically. Also,
by the way, Obama tried to fix it, by the way. Trump didn't even try.
2 minutes.
Until something happened.
Okay. Yeah, great. The states were expected to have stockpiles for this stuff, and the public-private partnerships. You don't start a brand new, so I know the biogen law, right? But you don't just make public-private partnerships for something that isn't really a problem yet. And I know you can be prepared, but the preparation argument you made is a little bit separate from this one. You don't start a public-private partnership with a company. So I'm not going to go to Gilead and say, hey, develop these rapid antibody tests unless we need the rapid antibody test.
Why didn't the pandemic response team do that?
Well, okay, so now I feel like you're gonna come out with he killed the pandemic response team. Do you think that he killed the pandemic response team, ended it?
Well, his direct quote was, I don't like having thousands of people around me who we don't need, in response to a question, why was the pandemic response team dismembered?
So it actually wasn't dismembered. The location of it was moved. That's the truth there. And it was renamed and it was moved to a different location, just not in the
Was
White
funding
House.
cut?
Huh?
Was funding cut?
Yes, but funding was increased in other areas, all directly relating to public health.
But not to pandemics.
But it's the pandemic response team is not the one actually directly handling the pandemic. The pandemic response team are the people who devise plans. Those same people who would have been on the pandemic response team are on the advisement committee and teams, especially at CDC.
It's kind of like
and
saying
NIH.
like in the FBI, the reason why 9/11 happened is we only had
30
three
seconds.
people during that time looking for future terrorists versus just investigating past ones. By moving that over, your response lags, but you handling it after the fact is a little bit better.
Well, with the federal government, moving it to a different location really doesn't make much of a difference at all. It really, it's a very benign factor in this whole thing, and I don't think that's an argument that anyone on the left or anyone that thinks he did a bad job should be using. I think my time is out, so I'm going to let you take the floor whenever Tyler is ready to change the time.
Yep. All right, time. All right, 5 minutes back on the clock. Dom, go ahead with your rebuttal.
Yeah, so I'm going to go over two things right now because obviously we could go over those for a while. So two things. One, I'm going to talk about how he spoke to the public and how that actually endangered the public factually. Two, I want to talk about really earlier you addressed the CDC numbers are inflated or the deaths are inflated. So let's talk about two things. And one really quick, just so we don't take up too much of my time. You agree that this is a big deal, right? You're not one of those people who said like, oh, this is not a big deal. We shouldn't have even shut down, or we should easily be reopening by now, like fully.
Yeah, so let me explain my stance really quickly.
Yeah.
I think that the lockdown was necessary for maybe 2 weeks to a month because that guaranteed the hospitals time to get supplies. But at this point, it's extremely excessive.
Okay. So and that's somewhat reasonable, right? So there's a few things I want to address here. So first off, you talked about the CDC numbers being inflated or the deaths, right? I tracked down the origin of those statements, where it started. 3 people started that statement. David Icke, the guy who thinks lizard people run the earth. A doctor who says that she's an anti-vaxxer, which I'm not trying to ad hominem her, but also has been under investigation for praying for her patients and charging the insurance companies for. And then the third one is a health official. Now, all 3 of them said we have no evidence that it happens, but it could be in their incentive. And in fact, hospitals cannot declare death of COVID on a patient. That is a medical examiner, which is not done by the hospital, but it's actually under the national medical examiners. And that is actually from the government. They have said that. Even under Trump, they have said that. So either you believe Trump is lying about that because he has supported that, or he's not lying, and then there is something in Trump, and like basically the numbers aren't inflated. So you got to pick one or the other.
Yeah. So is the public official that started this lie the lady from Illinois?
Well, it was a man. There's that lady, but there's a guy. And when they asked him about it, he said, "I don't know if it's happening, but it could be happening."
Okay, because the lady from Illinois, I live in the state of Illinois. I was watching the press briefing that day. The lady from Illinois straight up said that is exactly what is happening, at least in this state. And if you look, there's massive number jumps, and we have a strict lockdown here. There's massive number jumps just coming out of nowhere, like every 2 days, right? And I know that correlation is not necessarily causation of those massive number jumps. But, this lady, I forgot her name. She's our public health.
Yeah, Dr. Annie Bukovic or something like that.
Yeah. She straight up said this. She straight up said it. Also, San Diego County, they had a investigation into the situation. Only 6 out of their 100 and something COVID deaths were directly linked COVID.
Yeah, so I'll address that. So I'll show that there isn't plenty of evidence because the CDC has confirmed this under Trump. The Dr. Fauci has confirmed this. Multiple people have confirmed this. That's why Trump has never mentioned anything about this, because he's not trying to debate this. There's a difference, right? So one of our friends actually had a heart attack and no, he didn't die, but he had a heart attack from COVID. But the problem is he didn't even know he had COVID. It creates blood clots. It creates other issues. He thought he just had a cough. And so this is the problem, right? The numbers might be inflated by the hospital reporting, but by the time it actually goes to the CDC, it has gone through scrutiny and a medical examiner. Numbers are not inflated. In fact, the CDC and many people pretty much is not undisputed by only a few people, one of them, again, being someone who believes in lizards who run the earth, say that it's actually under It's underreported. Now, here's the thing. There are a lot of people like my friends who were affected back in December. We agree that it was back here in November, and people are attributing it to like the flu and different things like that. The number is probably even higher. My friends are paramedic, firefighter, and a lawyer and a police officer. They all live together. They all got deathly ill for about a month and a half of the cough back in December and into January. Deathly ill. That's when I bought my masks. I'm like, bro, this thing from China seems like it's going to be spreading. Now, I'm going to make it really quick because I'm going to probably address it later on. Trump kept telling the public it's going to be fine. What do you think the public's going to do when they go outside? Are they going to practice good health safety measures? Or when Trump keeps pushing the idea that like, hey guys, in April, it's going to go away. No doctor said that. In fact, they said because typical respiratory illnesses are seasonal, it could, but there's no evidence because there in fact are higher temperatures in certain areas where it's spreading. So there's no evidence of that. He kept spreading the delusion that it's going to go away. We only have a few cases. He could have then said, hey guys, let's start practicing safety measures. How about this? Let's start, everyone can start.
He did release the social distancing guidelines.
No. Actually, the WHO and the CDC did, right? They did their job. Trump went out on the TV and said, it's going to go away. That's like saying, hey guys, I'm going to release a report. Okay. This is going to get serious. But then I'm going to go on TV and say, guys, I think in about 3 days, like a miracle, it's going to disappear. That is not going to tell the public, hey guys, I'm not trying to scare you, but you guys need to start washing your hands. You guys need to start at least distancing a little bit. We could have saved so many people by at least practicing with the president saying, let's with leadership, get people to at least start practicing some measures. That could have helped the lockdown. It's excessive because of Trump.
Okay, well, in the same time period.
Hold up, Aadi. Let me reset the clock.
I'm going to like forget everything.
No problem. All right, I'll reset the clock. Go ahead.
So basically in the same time period where, you know, he was saying it's going to be fine. First of all, I feel like you're really misconstruing what it's going to be fine means. That's just public reassurance. You can say it's going to be fine. It doesn't mean, you know, there's no necessarily timeline. Then I remember, you know, he said something about Easter in early April.
He said it'll be gone in a few days.
Yeah, that is not a statement that I would have made, and that's not a statement that I endorse in any way. But if you really look at it, first of all, you said the social distancing guidelines came from the CDC. They were CDC in partnership with President Trump. They were released under the title President Trump's 30 days to stop the spread, which was then extended to 50 days.
So why didn't Trump at least report that to the people? Obviously,
he
people
did.
are going to sit.
One of the first press conferences of the daily series was actually literally about the social distancing guidelines. That was literally the entire headline.
What did Trump say? What date was that? Do you know?
Yeah, let me pull up a date.
Or roughly. I'm not going to judge you on like the exact date, but it was like February, January,
early March, I think. Give me 1 sec. 14 days.
Aadi, I meant to mention this is your last 5-minute rebuttal.
Oh God. Okay. March 16th.
Okay, March 16th. Yeah.
March 16th. That's when we really started to see a slow uptick in a slow uptick in cases in the country. It was actually hyper focused in New York. So my question to you: would you disagree with the premise that a targeted approach might have been better, not necessarily just for the public health, but sector of this, but also for the economic disadvantages that are coming out of this? Do you think a targeted approach would have made more sense?
Yeah, 100%. So there's something called pocket infection, and that's the reason why New York doesn't have it just because they're dense with people. They have it because of pocket infections. And I agree that Trump could have maybe not, like you said earlier, you said, what was he going to do? Lock down the whole nation? No, he could have actually stopped the 40,000 people from coming from China, which he allowed to come in with almost no.
That's just not how it works. You have to let in your own.
You can let them in,
but
you can put them places. You know what we did when
they had a 2-week quarantine.
No one they just said, lock yourselves in and go home. No, there was actually evidence people did not.
That is their personal decision. And I agree. It's a horrible decition, but you cannot.
It's Trump's decision to track it down and not say it's your personal decision. If you want to murder someone, I can't stop you. No, stop them. They're killing people.
You cannot put people, and I know you're going to be like, yes, you can, but you genuinely can't. You
put people in cages.
Dom, let him finish his thought.
That started in 2014.
No, I'm just saying generally.
You cannot force people to stay in one location, especially before there was actually like statewide lockdowns. You know, I think are you trying to say that they should have all be put in a location and waited there before they could return home to their families? Is that what you're saying?
Yes, I think instead of spending $2 trillion on giving people money, you could have spent literally a few $billion on buying out a hotel and putting them there and saying, look, or a few hotels or a dozen hotels, and saying, look, this is very serious. Wuhan's on lockdown for a reason. It's spreading by then. Yes, it wasn't in America, but it doesn't take a genius to say if it's killing thousands and tens of thousands of people across the world, oh, it's definitely not going to come here. There's definitely a difference between Chinese people and here. Like,
Okay, well, he didn't say there's a difference between Chinese people.
I'm saying like logically, right?
Yeah, yeah, and also there's like population and density. And I know that that doesn't necessarily play a large factor in what happened, but we were also like about 15 to 20 days behind these places, and every country kind of took a staggered approach from China. Yeah, every country took a different timeline. That's why you see India started a lot later than the U.S. and the U.S. started a little bit later than South Korea, and Italy started a little bit before, a little bit after South Korea as well. So you can't just say, you can't base it off, okay, China has 80,000 deaths, which I believe China has way more than 80,000 deaths. They probably have 23 million. I mean, they lost 23 million cell phone users over the time period, but you cannot say that, just because there's so many deaths in China, the same effect is going to happen here. That's just not how it works. And based on that premise, and maybe you can say that, but even if you do say that, you cannot base an entire nationwide lockdown, or even forcing people to stay where they don't want to be. You cannot base that off of that premise when there's no actual evidence of
30 seconds.
happening in this country. There's travel restrictions, plenty of research being done, and tons of other things going on at the time. It just didn't work out. You cannot force people to stay in one location, and you cannot base entire national action off of a different premise, especially when it comes to quarantining people. But yeah, go ahead.
Okay.
All right, Dom, this is your last 5-minute rebuttal. Go ahead and start whenever you're ready.
All right. So here's the thing that I have, right? So I want to go over the way he handled himself in public, because I think that played one of the biggest roles. Because I think, again, I could sit here and argue that they didn't react fast enough. And to be honest, maybe if I got there, because I know a lot of politicians, and I've talked to a lot of politicians, like Rashida Tlaib, is a friend, a family friend. I've known her for a while. And I talk with these people to kind of understand. And sometimes I learn even that when you're actually there, it is much different. And everyone can agree with that, right? So like, for sure, Trump did something. For sure, he acted too late, but who knows if other presidents, right? I'm not arguing that it's only Trump. But here's the issue that I have is, one, in February 26, he kept telling everyone, we're testing everybody that we need to, and we're finding very little problem. The number of cases will reach zero pretty soon. No doctor, not even the CDC, not one person supported that idea. He kept saying over and over again into March, it will go away like a miracle. It will. He kept, and I understand from his perspective, and this is the one thing that I agree that I think Trump kind of did well, is he kept trying to not tell people we're going to shut down for 3 months, because to be honest, it would get people to pull their money out. And I think financially, normally, economics wise, I think he's leading us towards a bad long-term goal. But I think in this way, he handled himself by being like, look, if we tell people we're going to lock down for 2 months, we're done. We're going to basically get everyone to pull their money out. Everyone's going to fire people. They're going to say their business is out. So I think he did a decent job of that. But the problem is, and then when it comes to the finances and the programs, I know people are complaining, I didn't get my money. Like, my family never got money. My dad has like 60, 70 employees, didn't get a loan. The money was taken. I wouldn't blame Trump for that. So I'm not going to sit there and say the financial, I think, sure, we could have done it better, but to be honest, our system's old as shit, and it's not his fault. He could have updated it, but so could have so many other presidents. So not here to blame on that. But he kept pushing in the public that it's not a big deal. And when you do that and you have millions of people that believe you, they're going to say, okay, well, it's not a big deal. So I had tons of friends back in March, even till now, say Trump's saying it's not a big deal, guys. He's just saying it because he doesn't want people to get, he's just doing it because the CDC is telling him to. And the problem is like he retweeted something saying fire Fauci, someone who did that. You cannot do that and push the idea, even if it's a retweet, even if it's just
What's
a hashtag.
What's wrong with firing a federal employee? I mean,
for what reason?
If you read the tweet, I think the tweet was from Deanna Lorraine, who's a little special. But it was talking about a lot of what Fauci said, and his reactions to what Trump said. I mean, and I'm not saying that I would personally fire Fauci. I'm not saying I would keep him either. All I'm saying is, if you're going to base an argument based on the premise that like it's not right to fire a federal.
It's not that I don't care about he shouldn't fire him or it's illegal to. He is doing it because he said something with no medical expertise. And when the doctor leading it and nobody under him disagrees, says, no, you cannot say that. No, it's not going to go away. No, it's going to last longer. No, it is transmitting. No, and then Trump goes out there, oh, well,
2 minutes.
yeah, just because he disagrees with him. That Fauci is the one leading this. It doesn't mean, and then now they're politicizing it where now you see like Rand Paul going in the Congress and being like, you think you're the end all in here. He's like, I'm not, I'm giving you my advice. I can't force people to stay inside.
But
well, hold on. So look, here's my issue is he's creating a divide between what the medical people are saying and what Trump is saying by saying, oh, well, he's disagreeing with me. He then turned and said, and this is what bothers me because a lot of people are saying, oh no, he never said to inject yourself. I'm sure he didn't tell people go inject yourself. He said, we could look into a way where we can inject disinfectants into the body and kill that.
Have you never heard of blood disinfectants?
No. But no. They were talking, he was directly talking about disinfectants of cleaning products and saying,
how do you know that?
Because he said it right before it. He said, we're talking about these disinfectants. You spray it down and it kills the germ. And he's like, and then maybe we can look. And yes, he was talking about cleaning. He's talking about those
that's
products.
How blood disinfectants work.
No, they don't spray down in blood disinfectants. That's there's products.
There's different.
Hold on. Listen.
Dude,
listen, there was thousands of calls into the CDC and to medical officials asking them if they should drink all these things. His words make a difference. And if that statement, which you even say, well, it's not what he said, that's not what he said. He even said, we can look into ways where we could put sunlight into the body, UV, which he looked at the doctor and the doctor looked at him and said, is that a thing? That's not a thing. I've never heard of that. And he said, well, maybe you should look into it. He didn't say, oh, I've heard it from someone else. He literally constantly tells the public, bullshit lies, nothing that's supported by evidence, contradicts the doctors. He even said at one point, I'm not a doctor, I can't recommend it, but you should definitely take this. You cannot do that. He is a leader, and he kept pushing the premise that it's going to go away, it's going to go away. That got people to believe it's not a big deal, so I don't need to follow these precautions. Tons of my friends who are Trump supporters said, bro, he's saying it's going to go away soon. I can go outside and go hang out with friends. He held rallies. He could have at least taken basic safety precautions.
Yeah, okay.
All right.
Wait.
All right, so we are going to go into our closing statements. Guys, this is your last chance. So closing statements, you do not interrupt closing statements. So this is completely on them. If you want to tie up any of the things that Dominic just said, Aadi, you can do that. You can read a closing statement, whatever it is. It's completely open to you. You have 2 minutes on the clock.
Okay, cool. Yeah, I mean, to say that he was genuinely telling people to spray Lysol down their throats is super disingenuous. There's many different terms that you can use for like putting in blood disinfectants. Spray can also be through an injection, which flows throughout your body. So that's just one thing. And secondly, this is just my outlook on it, but no matter who it is telling you to drink bleach, which didn't even happen. But if you think that you should drink bleach, if you honestly think that, maybe you should drink bleach. That's my outlook on it. I mean, it's a personal decision. That is a very personal decision. No matter who it is, it could be my doctor telling me to drink bleach. I'm not going to drink bleach. It's just called being not mentally deficient. I mean, if you're seriously out there drinking bleach because the media told you Trump said that, you are a moron. You are a literal moron. But anyway, this was a great conversation. It felt more like a conversation than anything else, and that's how it should be. Thank you, Tyler, for having me on here. Make sure you follow me on Instagram and at literally every other platform at PoliticalBhanti. Thank you. Good stuff, Dominic.
Absolutely. All right. Okay, Dom, 2 minutes. Go ahead and get started when you're ready.
Yeah, so biggest thing is we never addressed why Trump never fixed the national stockpile early on. We never addressed why he's claimed that testing was going perfectly, but then the second it didn't, he said it's Obama's fault, even though I showed you and proved to you that it was not Obama's fault. He also then talked to a nurse, and there's a live video where the nurse said, he said, did you get proper equipment, the PPE equipment? She said, no, we actually did not. And he literally turned to them and said, oh, well, I don't know where you're working. What about you? And tried to avoid it. It's okay to say, you know what? We didn't do a great job. I wouldn't have blamed Trump to say he didn't do a great job if he claimed that here's where we messed up, because it shows I'm a grown up. We did mess up here, but we're going to fix it. He did none of that. Instead, he spread lies to the public, telling them constantly, and you have not addressed this, is why did he tell people it's going to go away when no one said that? Why did he give them false hope? It's different to say we're not going to lock down for long, and I understand that. Because, people say, okay, we're locking down, but maybe not for that long. But to tell people it's going to go away, or it's going to go away in April, which no doctor supported that, is just lies. And it gets people to believe it's not as big a deal as it is. And then they go outside and they spread the virus. The other thing is when he said, well, if someone tells you to drink bleach and you do, then you're an idiot. He's speaking to 360 million people. 1 out of 5 people have a mental disorder. That's like saying, oh, you got Down syndrome and you didn't know you shouldn't drink bleach. Well, you shouldn't have Down syndrome. Yes, he's speaking to 360 million people. There are going to be people who listen to him. You shouldn't even do that at all. If you're like, well, I mean, you shouldn't be an idiot and misconstrue my
Good
words.
thing he didn't say it.
No, but he said,
30
we can
seconds.
find a way to inject. He also told people to take a medication. He said, I suggest you take this, but I'm not a doctor and I can't recommend it, but I suggest you take it. That is recommending it. If that is the most bullshit way around of saying, I'm not recommending it, but take it. There's a person who actually died, by the way, from taking medication that he claimed worked. And that's the problem is, yes, you shouldn't be that smart if you do that. But there are 360 million people he's speaking to, and he's the president. You cannot say, well, if you're not smart enough, it's your fault.
Good thing
right.
he didn't say that. I was just, giving you a scenario.
And that's a wrap. That is a wrap. That is 40 minutes, man. Did y'all guys have fun?
Yeah,
I did.
It was a good conversation,
very
right?
reasonable. So Aadi's very reasonable. I was worried he's going to be like, yo, this virus is not even a big deal at all. Because that, you could destroy that in 2 seconds. I had my flu numbers out and everything, but he at least is coming from the sense that, yeah, this is a big deal, but we don't need to be locking down for 6 months. And it's reasonable because people are suffering. I have friends, I think I know 30 businesses that are shutting down, friends that own businesses for years. It is very difficult.
Sure. Aadi, you have fun, man?
Yeah, no, it was a good time. It was a good conversation. I enjoyed it.
Awesome. Where can Dom, where can people find you online?
Yeah, so if you guys want to find me, best place to find me is my Instagram at Dominic Andre _, and you can kind of direct all my social medias from there.
Awesome. And Aadi, where can people find you again?
Instagram, TikTok, Twitter, at PoliticalBhanti, and then wherever else, YouTube, all from Instagram. So.
Awesome, man. Sounds good. And what about you guys listening at home? Who had the better arguments? Remember, you can vote on who you think won on our Instagram page at 40 Minute Debates. But the poll is only open for 24 hours, so make sure you vote quickly. And if you like this debate and you want to hear more, then make sure you follow us on IG, subscribe to us on YouTube, and until next time.